Hello, everyone. This is Dallin Lovell, Balanced Body Physical Therapy. And the topic that we are going to cover today and over the next 2 weeks is sciatica and hip pain. And a lot of people will say, well, why are you talking about these two together? Well, clinically, we see these types of symptoms appear together many times, and they can confuse some clinicians and healthcare providers because sometimes they just don't take the time to do the testing necessary to differentiate which is the problem and which isn't. But if you look at the diagrams that I actually have shown, we've got and so you have the pubic symphysis in the front, and then you have the actual sacroiliac joints at the back. Now, if you sprain a sacroiliac joint, you can get pain directly in that joint that can radiate into the back, but it can also radiate into your hip and buttock area. And so hip pain radiates a lot of times from the hip itself, and it can radiate up towards the back, but it can also radiate down into the thigh. And so many times people will come in and they'll be diagnosed with sciatica when in fact they might actually just have degenerative joint disease in the hip. And so we have to be really careful to make sure that we differentiate those very well and to make sure that we don't make any errors. Going on, I wanted to talk about the muscles. So if you look at the diagram that I have up, we actually will see the hip musculature. So you'll see that big gluteus maximus as it comes off of the pelvis and it attaches onto that greater trochanter, the femur. You also have a gluteus medius, you have a gluteus minimus, and then you have your hamstrings that cross there. You also have a muscle called the tensor fascia lata that actually will go across that and attaches into a ligamentous thing called the IT band, thigh, and knee. A lot of times you have to look at where the pain's coming from. So if you have pain that's coming from deep inside of the hip, that could be indicative of a sciatica type thing. It could be coming from the back because of where those nerves are radiating the pain from the back down towards the leg. If it's more superficial, right around the outer part of that hip where it's very tender to touch and it hurts a lot when you move it, a lot of times that's a bursitis or a tendinosis type of a problem. If it's deep inside the hip and it hurts with weight bearing, and as soon as you get off of it, the pain goes away, sometimes that's an arthritic condition. There's other types of issues that you need to be looking for, such as does it radiate to the groin area or to the inner part of the thigh and pelvis? Does it radiate up towards the back? Both of those definitely need to be looked at, and it's hard to just tell someone, hey, this is what I want you to do to look for it, because you need a professional to actually evaluate you to determine whether or not that's going to help you out. Now, as we finish up, I just want to remind you that the best way to have a problem resolved is to decide, okay, I'm having the pain, I've tried just heating, icing, I've tried taking it easy, I've tried changing my activities. If none of that works, you really need to go see a healthcare professional. And physical therapists, we have direct access in the state of Utah, so we can see people off the street. You want to see somebody who specializes in doing orthopedics. And so clinics such as ours, we specialize in doing outpatient orthopedic treatment, and so we are able to assist you in the evaluation of any type of problem that's musculoskeletal and that is affecting you in your daily lives. So if you have any other questions or comments, you can always contact us at balancedbodypt.com. We have a chat window. You can also go to our various social media pages and you can ask questions. But the best way to get hold of us is through the chat box on our website, and that's in the slides that follow up this video. But it's www.balancedbodypt.com. BALANCED, body, BODYPT.com. And we look forward to helping you out, and I hope you enjoy the rest of this series. Thank you very much.